Alive and Well STL is a presentation of the St. Louis Regional Health Commission with the first decade review of health status report to build a healthier St. Louis, and RareGem Productions. Power up with the positive. Learn more at OneRareGem.com. That's OneRaregem.com.
Support for Alive and Well STL comes from Beyond Housing, helps entire communities become better places to live. Learn more at beyondhousing.org.
The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve healthcare access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL with Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network.
There are so many influences outside of the doctor's office and hospital that affect our health and our quality of life. Today we're going to talk about how your environment, your daily routine, your relationships, your networks, and other factors impact your health and your quality of life.
What I want St. Louisans who are listening to this show, what I want them to realize is that our city is not a city of the past. We should not take all these negative comments about the problems with our schools, the problems with our poor health, the problems with our violence, and say that these are insurmountable. We can resolve these problems. We can become a healthier community. But we have to get beyond this mindset that it's just too late. It is not too late. We have to collectively become advocates in the ways that we linked arms back in the 60s. We could do the same thing metaphorically in addressing some of the ills in this city. I know it has the potential to succeed.
We'll be right back.
What does it mean to you to be alive and well in St. Louis? We want to hear your story. Tell us what it means to you personally, what you need to achieve it, how our program may have helped, or even some of your best recommendations for the rest of us. You can share it on the message box at 314-333-8369. You can send an email to info@OneRareGem.com. You can even post it on Facebook at ONERGP or on the Hallelujah 1600 page as well. We'll share your message with our community to help make it possible for everyone to thrive. It's great to be alive. Be alive and Well STL. 10 a.m. Mondays on Hallelujah 1600. RareGem Productions proudly presenting the positive. Alive and Well STL.
Hello, St. Louis. This is Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network and host of the new program Alive and Well STL, sponsored by the St. Louis Regional Health Commission. Today, I'm so pleased to host Dr. Will Ross, Associate Dean for Diversity and Associate Professor of Medicine at Washington University School of Medicine, who's also a charter and founding member of the St. Louis Regional Health Commission. Dr. Ross, welcome to the show.
Thanks, Bethany. It's always great to be back here. I appreciate this format and the opportunity to speak to the listeners of the show. I just commend you and your leadership in making this collaboration possible. So I think it's a great opportunity to get some good information out.
Thank you. Dr. Ross, your credentials and contribution to the field of medicine are almost too numerous to mention. So let's take a moment and tell us, what are you most proud of that you've done, a program perhaps that you've helped to implement that's making a difference in our community?
Bethany, I think it's hard to say something that I've done. I think we, all of us, have been working together. And so I would say that, there's some particular programs that as a collaborative effort have been, I think, quite productive, meaningful, and have had an impact. And I know I can elaborate on maybe three of those. I think first is just simply increasing this awareness of public health. Public health is underappreciated nationally and locally. It's underfinanced nationally and locally. And we have workforce constraints, both nationally and especially locally. And so it's so important to let people know that public health is a powerful area that in terms of its effect on our lives. And we have to approach it and fund it at the same level that we do health care. And its effect has to be highlighted, and it has to be resourced. It has to be taught. And it has to be embraced by those in academia and those in the community. And I would say, since some of the early stages of public health, I actually had the opportunity to write a review of public health in St. Louis in 1997 and share that with a lot of community agencies and academic institutions. And I'm proud to say over this 17 years or so that a lot of those recommendations have been implemented. I've seen significant improvements. And so we've made changes. You're aware of our public health efforts at Washington University School of Medicine and the things that we're doing now at the Department of Health in terms of elevating sharing services. And so I think that we've made an impact there. And I have to admit the Regional Health Commission is right there on the list of efforts that have truly transformed the health and healthcare of this region with great collaboration. It was something I was concerned about when I left Regional Medical Center back in 1987 when I was the Vice President of Medical Affairs, I was concerned that we were not going to have this regional approach to address and ameliorate some of our health issues. And RHC, created in 2001, has really just assumed that responsibility. And we all are just quite pleased with the durability of the Health Commission and the continued commitment to these resources. And I would say something that's an extension of that is the fact that as a physician, I have to be able to relate to my patients in a language they have to understand. I have to be able to relate to the community in a language that the community understands if I'm truly to make a difference in terms of improving health. And that means understanding health literacy, the ability to really present information and help patients and the community members understand this information, process it, and really use it to improve their lives. And so we were on the forefront of actually creating health literacy programs here in St. Louis. Of course, through the efforts of the Regional Health Commission and the Missouri Foundation for Health, culminated in the creation of Health Literacy Missouri, which became a national model. And so I think collectively we've all worked on some great projects, and we should all be proud of our successes in public health over the past 15, 20 years here.
Introduce yourself to our listeners by telling us why you choose to make St. Louis your home.
Well, Bethany, I'm a product of the 60s, of the civil rights movement in Memphis, Tennessee, and we all know what happened in Memphis in the 60s, and I was right there. And so I saw this, and so I really embraced this desire for social change and for social justice. And it was my desire to be an element of change in any community that I decided to stay in. And so I came to St. Louis, not for St. Louis, I came for Washington University School of Medicine, to be honest, as a medical student here. But when I walked in the door, I'm interested in the community. And so I started asking about St. Louis as a community. And on the one hand, I saw some difficulties with the community. I saw this lack of integration of services, lack of financial resources to address health care. I saw a community that felt disempowered, disengaged. But on the other hand, I saw the potential. I said, look at what we can do. We can build this community, and I wanted to be a part of that. And so I decided to stay here, and hopefully with so many other similar like-minded people, become elements of change. And so St. Louis is my home, and I have every intention of really having it live it to its potential.
What does it mean personally to you to be alive and well in STL?
Alive and well in STL. That means that I know who I am. I know what factors are causing me to not be as healthy. I can look in the mirror and say, these are the issues I have to face. And then I can feel that I have the power to overcome those issues, either through my own ability to control, to manage my disease or my health, or collectively with great social support, or through the health profession or the public health profession. I understand what I need to do to keep myself healthy. And I am going to be active. I'm not going to sit back and say, what can I do? Or woe is me. I'm not going to do that. I'm going to get off the chair, and I'm going to make myself active, healthy, and find the resources I need to sustain my health.
Over the last several weeks of the show, we've been discussing highlights from the report of the St. Louis Regional Health Commission that looks at our health over the past 10 years. And you were on the steering committee that developed this report. One of the topics is called social determinants of health. So, Dr. Ross, define that word, social determinants of health. That's a mouthful.
It is a mouthful. It's kind of a lot of jargon. And we want to say that it's this new era. It's this new approach to addressing health. And let's kind of reduce this to the point where our listeners would say, well, wait a minute, I understand this. Social determinants of health is not new, okay? It is not something that was created in some social science laboratory. It's what our listeners, it's what our patients, it's what our community has been screaming about for years, for decades. They're saying when they're unhealthy that, doctor, I have some issues in my life that are driving me to be unhealthy. I am stressed. I have these competing health issues, these competing priorities. I'm having trouble on my job. I don't have a job. I can barely stay in my house. I can't afford the bills. The police are either there or not there, and then when they're there, they're not doing what they should be doing. These are all the factors that really just weigh on the shoulders of those who are living, particularly in under-resourced communities, and it's driving them to feel weighed down when they walk into our offices. And so, what do we see as providers? We see patients who are not taking their diabetic medications, patients who are not taking their asthma inhalers, and we blame the patient. And we have to get beyond that. Social determinants of health is a way of teaching the health community, not the broader community. They get it, Bethany. they've been screaming at us to understand these forces. The medical community is now recognizing that we just can't be deliverers and prescribers of medicines. We have to be deliverers and prescribers of social support to improve our patients' health, our community's health.
Are there programs like that are in place that help the medical community to understand the needs of the community better?
We're in the process of, I think we're all, to be honest, in the infancy of developing programs that will teach all of us, whether we are physicians or students or trainees, how to become aware of the social determinants of health. And there are instruments, there are tools that are marketed that are produced by the medical centers, the Centers for Disease Control, the Institute of Medicine, and I mean there's a lot of information out there. Now, let me give you an example of what we're doing at Washington University School of Medicine, and I was really pleased to see the recent article in the Post-Dispatch on our training our students to be attentive to social determinants of health. We bring in students every year for a program called WUMP, Washington University Medical Plunge. And rather than teach them health in a medical school, in a kind of a sterile building, we create a virtual medical center. We take out the walls. We drive them through the community, not as tourists, not as voyeurs, but we have them get out of the bus, walk through the community, and say, "Look around you. These are the factors that affect the health of our community." And they'll see the lack of restaurants and a lack of grocery stores. They'll see the vacant lots, and they'll see some of the buildings are in disrepair. And they'll say, "Well, gosh, this is going to contribute to chronic stress of anyone living in this community." And so they will sense, well, my goodness, if the community is unhealthy, then the individual in the community will be unhealthy. And as a practitioner, I can't just simply treat the person. I have to be just as involved in treating and improving the community. When we do that, starting at the level of our early trainees all the way up to the higher echelons, then we will have meaningful training and ability to effect change to address these social factors.
How exactly do these factors like roads, sidewalks, parks, access to healthy food impact our community's health?
Well, there was there's this concept. I think many of us heard of this. It's called the broken windows hypothesis. I think it was promulgated by social scientists, if I recall, in New York, maybe in the early 80s. When you walk past a community and there are broken windows, there's a sense of neglect and a sense of social isolation, a sense that nobody cares about us, and this becomes internalized. Nobody cares about us, and I can't change this. Therefore, why should I worry about my health? But if you fix the broken windows and show that you care about the community, if you dump out the trash, if you fix up the buildings, you put a fresh coat of paint on, okay, you fix up the lights, you bring in community policing that's attentive to the needs of the community, you put in community health centers where they're needed, and all of a sudden the people will say, my goodness, someone cares about this community. They care about us. I'm part of this community. I'm going to be healthy. And so, it's a concept of. It's not a new concept, but it's a way of just simply saying that we're all products of where we live. Place matters in public health, and if you're in a place that's unhealthy. And I grew up in an unhealthy place in Memphis, Tennessee, and I can relate to this personally. And I've seen so many both family members and members of my community develop poor health as a consequence. If you don't become active and advocating for change and making that place better, then you're basically consigning everyone in that community to poor health for the rest of their lives. And no amount of intervention, 10, 20 years later will change that. And so we have to start creating healthy places, healthy communities, and we have to start doing so collectively. It's not something that one person can do, but together it's amazing how much we can adopt. And I can give you some examples. We can talk about things that have happened in St. Louis. So I do think it's possible. One of the examples that I use is when I first did report in 1997 about health in St. Louis, I called out the high rates of lead toxicity in our kids, rates as high as 30% or so. And our community said this is enough. We don't want our kids to be lead testers, and then the only way that we can address the long-term health implications is by closing a lead mine or treating our kids with medications to reduce the lead. That's too late. The community said we want to do something about this, and so they got together. They were empowered to work with the mayor's office, the public health department, to create a number of interventions, leveraging grants to do lead abatement, painting, removing lead from the window sashes and from the yards. And so through this collective effort by people who understood social determinants of health, they may not have used that word, but they clearly knew what that meant, that they needed to have healthy communities. Through those collective efforts, we've seen a reduction in those lead rates down from upwards of 30% to 3%. Just remarkable. So we can make a difference in our community if we take this as a collective approach, if we have this collective efficacy and understand this collective agency, then we can be empowered to make change.
So you've spoken to us about a revolution in motion and the importance of individuals engaging in that revolution. What is the first step that someone listening today can take to engage in that revolution?
Well, the first step is to do self-diagnosis. Okay, you can't fix a problem until you know that there is one. So you look in the mirror and you say, "What am I like? I mean, what kind of a person am I? What kind of health do I have?" And then you have to say, now, if I don't have that health, what do I need to do? Who do I need to go to become healthy? And you have to realize that that level of influence to make you healthy extends beyond just the patient-provider interface, beyond the physician. Who are the people who can provide social support? Who are the people in the community, in schools and churches who can actually help provide support to make me healthy? You do that, and then when you feel empowered to make yourself healthy, you're going to say, now, I live in this community. I love this community. I don't want people shouting down St. Louis, and I'm tired of reports showing how since St. Louis is not going to do well, we have these horrible disparities. I want to be proud of my community, and so our listeners have to really believe this, that they can make St. Louis great, but we have to be empowered. We have to go in and start advocating, screaming for change, screaming for community involvement. To reduce rates of violence, to have adequate policing, to have social support, to have drug courts, and to have people like Judge Jimmy Edwards, do all the great things he's doing. We need more of that. We can start screaming to actually provide our young girls, our young ladies, a sense of support that elevates their self-esteem, so they aren't subjected to degradation by older men and then become victims of sexually transmitted infections over and over again. We have to actually be empowered to make changes in our schools so that so not only are the standards high, but the teachers are respected. This has a strong impact on our health and the health of our community. And we can't just say that, okay, there are administrators doing this. We are the people who should be involved. And so when we have this collective action, this collective empowerment, then the whole community benefits, and we benefit because a healthy community translates into a healthier individual.
I'm going to start wrapping up by asking you one question in two parts. As you look at the Regional Health Commission's 10-year report, what trends are you seeing that are alarming to you, and what trends are you seeing that show promise for our future?
Well, I'll answer the first one. The promising part is the fact that I'm looking at you, Bethany, and your leadership with the Integrated Health Network. And the community should know that you really are just a phenomenal leader in this community. And I hope they appreciate all the efforts and all the sacrifices you've made to make this effort work. And by having this integrated approach to health, we understand now that the community health centers have to share resources and services, and we have to start collectively promoting access to care. And because we've done that, along with other things that we're doing addressing preventive health, we've seen this remarkable reduction in chronic disease rates. I mean, it's just absolutely astounding. 27% reductions in mortality from cardiovascular disease, strokes, and reductions in hypertension. 20% reductions in cancer mortality. This is remarkable over a 10-year period. This is not just preventive health alone. This is activism at the level of people on the streets, in the health centers. Those who are advocating for change for our whole healthcare system. This is remarkable. I am proud of that. And I know that all of us collectively are saying we can make a difference. We're not just simply victims of passive victims. I mean, we can become active. But there's some things that are alarming in St. Louis, and that is we need to take that same level of activism and translate that into sustainable approaches to reducing violence in our young men who are subject to this chronic stress, these chronic episodes of violence. Gives them this sense of hopelessness. They don't see the social support. The person who can be there, who can hold their hands, and so they live under this constant sense of pain and anguish and despair. And this is internalized, and they say, well, what is there to live for? And so it becomes perpetual. We can take the same public health approaches that we use to reduce cancer and cardiovascular disease and hypertension and apply that in a manner that is sustainable and evidence based in public health to our young men who are involved in gangs. And so there are so many ways of doing that. There are great models, and I know that there is a model called GREAT, gang resistance. And so, but we have to, as a community, have to realize that it's not just the police force that has to be involved. This is a community effort, a public health effort, and all of us have to be involved in providing social support, in providing job opportunities, promoting educational resources for these young men, primarily young men, to do this. This has to be done because it's just unfortunately consigning just a whole legion of our brightest young men to become disengaged with society.
Dr. Ross, is there anything else that you want to add or make sure that you communicate to our listeners that I haven't asked?
Well, I think that you've been spot on, as usual, with your insights into the issues in our community. What I want St. Louisans who are listening to this show, what I want them to realize is that our city is not a city of the past. We should not take all these negative comments about the problems with our schools, the problems with our poor health, the problems with our violence, and say that these are insurmountable. We can resolve these problems. We can become a healthier community. But we have to get beyond this mindset that it's too late. It is not too late. We have to, again, collectively, I've used that term many times in this interview, collectively become advocates. In the ways that we linked arms back in the 60s, we could do the same thing metaphorically in addressing some of the ills in this city. I know it has the potential to succeed. I'm absolutely committed to be part of that effort. And I want our listeners to join me in that effort.
Dr. Ross, I want to thank you sincerely for your energy. Your passion is contagious. And I hope listeners are feeling that and capturing that bug of revolution. Thank you so much for your time and for your work and your leadership.
Thank you very much.
Alive and Well STL. Thank you for joining us today. For resources available, go to aliveandwellstl.com. If you have more questions about the program, need help, or want to connect, please call the message box at 314-333-8369. The Regional Health Commission with Chief Executive Officer Robert Friend Jr. committed to providing a detailed review of change over the past decade in 14 leading health indicators for the city and county of St. Louis. The first decade review of health status report, an update to building a healthier St. Louis. Discover the narrative, the data, and celebrate the progress already made to improve healthcare access and reduce health disparities in our region. Learn more at STLRA rarehc.org. Alive and Well STL is another positive production of RareGem Productions. Thanks for listening.